This patient presented with severe pain in the upper abdomen, and the CT scan was done to evaluate for the cause of pain. And as you can see, the patient has distended stomach, likely secondary to eating food, and there is this free air in the anterior part of the abdominal cavity. The way we know that this is air is if you change the window and see the findings on the lung window, you can see there is free air in the non-dependent portion part of the upper abdomen. Another clue is look at the wall of the bowel, and this is the stomach, which you see, and this is the large colon, and you can see the wall of the large colon. So this air is within the large colon, but this air, which is in the non-dependent portion of the abdominal cavity, has no wall to it, and it has angular margins at the edges that suggest it's free air. Another clue is try to find other foci of air which are not surrounded by thickened bowel. So like this area here, there is free air. These bubbles here are also free air in the abdominal cavity. So now we know that there is free air. Where is this free air coming from? We look at the bowel, and the stomach goes here, this is distended, and down here you can see there is wall thickening of the distal stomach, and this is the part of the pylorus that is thickened, and then there is this mesenteric haziness in this area. So that clues you in into the area of probable abnormality. So this looks like they have bowel perforation, and in order to identify where the perforation is, we kind of have narrowed us down to this area of the distal stomach, and right here the stomach becomes pylorus, and down here this becomes the first part of the duodenum, and the second part of the duodenum is right here horizontally, and the duodenum shows mild edema around it, but the majority of the edema and fat stranding is in the level of the pylorus, distal stomach, and the first part of duodenum. So a clue to find where the perforation is at is to identify the air, small focus of air around that area. So as we know that free air rises up because it has all risen up here in the anterior abdominal cavity. We'll try to find out where we can find a focus of air which is outside the lumen of the bowel, but is in the dependent portion, a relatively dependent portion. So if we see this part of the bowel, here we can see small focus of air under the right lobe of liver right there. And this focus of air, as if we track it down, we can see it communicating with the air in the lumen of the pylorus. So this air can be tracked from the lumen of the pylorus, and then there's this perforation here, and it can be tracked superiorly under surface of the liver, and this can be seen communicating with the free air in the abdominal cavity. So this lets us know that there is perforation of the bowel at the level of pylorus with air tracking along the anterior wall of the pylorus. That's where the perforation is, and leading to free air in the abdominal cavity. So this is a perforated pyloric ulcer.